So we are EACTS today. We just came out of one of the great sessions that we had today on low-income countries, and we've got Emily Farkas, one of our surgeons, who's been really involved in several projects and partnerships with other hospitals, and Dr. Gyan, who works in Ghana in one of the main hospitals, one of the main hospitals in Ghana, in the city of Accra. So, Emily, just tell us a bit what's going on. What's going on in the low-income countries? What's the problem?
Yeah, well, the main issues. We need a little more time for all that, but the session that we just talked about was really looking at strategic partnerships with societies and organizations and how we leverage those to address the big problems. And the big problems are, for the patients, obviously, are access to care, education about rheumatic heart disease, being able to afford and, like I said, have access to the surgery that they need. What we're looking for are partnerships, collaborations, force multipliers, ways to address that capacity building. And Dr. Gyan gave a good talk about how his center at the University of Ghana Medical Center has been affected and to the point where they're serving their community very effectively now. Do you want to tell us a little bit about that?
Yes, actually, thanks to this sponsorship, we set up a center just about 3 years ago. We started in 2022. We are at the beginning, we are growing, the numbers are increasing. Now we are getting people on our waiting lists. It's just that most of them at times come in and cannot afford. So we still know that we are growing and the numbers are going to increase. Complex cases are coming in and we will keep them for the mission to come and help us do them. But for the meantime, we'll continue doing the simple ones, but most of the time, some cannot afford. And thanks to your collaboration, we are doing some of them for free without asking for anything. We want to increase the numbers. We want to do more numbers to get more confident in our team so that at least our patient will also have trust in us to come to us for heart surgery. So thank you for the work you are doing.
So talking about this partnership, it's not just resources, it's not just money, it's as well learning. It's a component of that you don't have the access to training, or even you can't train others in the center. So how do you think these collaborations can help to train yourself and other surgeons that will be in the future in your unit?
Yeah, so this collaboration, at least most of the time when it come with experienced hands, senior group. So we come with nurses, we come with ICU nurses, with scrub nurses. We all have to train our team from beginning, because what happened is that some have never had the exposure of cardiac surgery. So these come with that training and that help us. We also benefited with one trip that we did about a year ago, where we went to see how cardiac centers actually work, how the team work. So that one also helped to improve our care for our patient. Now we have it that we want to start a residency program, which we want even the team coming to be part of the tutors or the lecturers in that group, so that when you come, instead of doing surgery, you'll be teaching residents and fellows, and the nurses will be teaching the cardiac nurses, so that at least by 5-10 years time, this unit will be very strong to train others, so that will open way to improve the healthcare in Africa and in Ghana as a whole.
I think you touched on a very important point, which is sometimes the surgery is the easiest part of the proposition, isn't it?
Yeah.
It's training and upskilling your team around you to support you and your colleagues, right? With, like you said, anesthesia, ICU nursing, OR nursing, perfusion, all the key players that make it a safe proposal, right? And so I think, and you were referring to the visit that you took to the UK to Dr. Inakakua's center, right? To understand really what it's like at a higher volume center and the flow of things and the protocolization and all of the things that you could implement when you take it back to your own center.
The three of us, we've been part of this collaboration and partnership. So you came to the center that I work, and I think this is one of the things that I highlight in the last project or the last mission that we did a week ago. Now the surgery seems like it's fluently going. The theater environment is just easy. Nurses in the OR, they can fly in everything. Your perfusionist had the confidence that he never had, but it's now we need to concentrate in other aspects. And for you to be successful, I'm afraid it's not just about the surgeon, it's the rest, and it's the ward, it's the ITU. But I think you have a fantastic team. They all really encourage and they're open to learn. So I think you'll get there. It's just, I mean, the process, it doesn't take 2 days, is it? It's a long-term process.
It's a long-term process that we started. And actually, last week when you were there, we could see that we did not spend 9 hours doing discussion like we used to do. It looked like we have grown a bit from, we used to be discussing cases. Even at the last hour, we still don't know who is the next patient we are going to operate.
What did we call it? Night school.
Night school.
Yes, the night before we were trying to sort through the judgment and the questions, and yes.
But this time it looked like what we planned before, it ran smoothly. We did not change our program. We did not spend more time discussing. Actually, as you said, we have to focus more on now ICU and the ward. I have to maybe dedicate more time with the ICU nurses and the ward so that the patient follow-up will be complete. Yeah, I'll take that.
I think it's been so rewarding for colleagues like Christina and I to see the evolution of your program, the tone that you've set for your team, and how they've, risen up to meet the standard and really come together to grow. So it's been, like you said, from the first time to now, and looking at those numbers you presented. So when you look at the numbers that were performed by the local team without any mission assistance, I mean, they're triplicate of what we've been able to help you with. You say you're doing simple cases. No case is simple. No rheumatic heart disease is simple in Ghana. So it's really the complexity that's now growing that we're continuing to assist with.
And one thing I like is, we discuss the cases. Even after you've left, we discuss the cases. We plan the surgery even before the team leaves. So I have almost everything organized and it just to run through. And actually, it's very, very helpful when you have echo decision precise and you know the technique, what you're supposed to do. That helps a lot. So I have a waiting list waiting so that I can go and clear them now.
So Emily, just to finalize, EACTS has a new fellowship, for surgeons who want to help in other countries. So tell us a bit about that.
Yeah, so EACTS just in 2025, through their Francis Fontaine Fund, partnered with Edwards Life Sciences Foundation, their Every Heartbeat Matters program. And so for members of EACTS, surgeons who are wanting to assist with humanitarian outreach or already involved in programs, they can apply for funding through this Francis Fontaine Fund and, apply it to programs like a UGMC and otherwise. So it's something really compelling, and we want to get the word out because I know there are so many people doing great work and they're looking for funding, and this is the way to have EACTS be the global home of cardiothoracic surgery, which they are. So it's a nice opportunity.
That's fantastic. Well, thank you so much. Enjoy the rest of the conference.
Thank you.
I'll see you soon.
Sounds like you need to get back to work on that waiting list, huh?
Definitely.
All right.
Thank you.
Thank you. Thanks.